So hi, I'm Bart Carter from High Energy Shockwave, and I have been doing this for over 20 years. We're going to bring you a lot of information about the high energy shockwave that you're going to want to know for orthopedic issues that you've had that other things haven't corrected. What I want to do today is bring you some information about the high energy machine. The high energy shockwave machine is much more powerful than a low energy machine with the handheld devices that you see that you've tried. And I know that there's a lot of modalities out there that like people try, they don't get the results that they're looking for, but across the board for 30 years, high energy shockwave is the way to go for orthopedic issues that need to be corrected. Yeah, we want to show you a little bit about the machine. I'm going to try, if I can. Can you see the inside of this machine? So the blast chamber is this size, and anything, in any kind of like low energy machine, they don't even have this available, but this is the whole entire blast chamber that creates the sonic blast generated by this. And I wanted this turned around the other way where I can see. I'm not used to a machine like that. Okay, so here is a spark plug that is creating the energy, the healing energy from the sonic blast. Anyway, this is the mechanism that like drives this whole machine. All right, I want to introduce you to Matt, the PA here at PAC at VIP Health and Laser. All right, I want Matt just to tell you a little bit about what he knows. We've been doing this about 5 years together here, and he wants to share some things that he knows about the high energy shockwave.
So as you can see, this is a big machine for this particular device to help patients correct orthopedic injuries. This machine has the capability to deliver energy that small machines don't even compare. Energy can travel deep into tissues, joints, ligaments, tendons, 7 to 9 centimeters deep, and in doing so provides the correction for the injury by disrupting calcification, scar tissue, improving blood flow, and developing new blood vessels. It's usually a once and done type of treatment. The good thing is that it's a very good modality that is generally corrective for 80% of orthopedic injuries. And Bart has an extremely good reputation with honing in onto the anatomy, focusing on where the injury lies and where to focus the energy so that we can get the best possible results for patients.
To correct the injury.
Yeah. So the device is just absolutely an amazing modality, which is, and this is essentially a regenerative medicine type of treatment. Focuses exactly at the injury where it lies, and it's very well tolerated. There's no cutting or surgical incision involved. The area can be numbed before the procedure, and it takes approximately 30 minutes to an hour to
get started. So Matt and I want you to understand from a patient's perspective, what a procedure does. And I want him to kind of explain it a little bit from his perspective.
So when a patient contacts us, comes in for a free consultation or even gives us a call over the phone, we're happy to give more information based on the injury they're experiencing and how we can help them. So normally we schedule them with a free consultation. We talk with them, get details about how this injury happened, how long it's been going on, what other types of modalities they've tried to correct their injury. And then we make sure that they're a good candidate. Most people tolerate the procedure really well. So they'll come into the clinic, we'll get medical history, we'll get medication, their medication history, get an idea if they've had any surgeries, see what kind of function they have, and consider doing an MRI or X-ray if they haven't had one done already. And that can help to some degree to allow us to focus in on the anatomy where the actual injury is taking place. So when they come in, they'll, once we've got everything set up for them, we bring in the machine. They can tell us, yes, that's the exact spot. And then the machine sort of highlights the area that starts hurting, and we can focus in better on that. So we do rely on patient feedback too much, but the injured area, when we find it, it's a very focused type of shockwave energy that goes to the spot, and they can tell us, yes, that's it. Once we get started, the machine starts to do its thing, and we move the bladder of the machine around to focus it exactly on everything that's potentially injured that needs correction.
That's right.
Then if for some reason it's too much discomfort, we can use numbing with lidocaine as necessary. We do need them to give us feedback, so we can't numb it too much. But like I said, it's tolerated fairly well. So the amount of power can be turned up to get better correction or deeper focused energy in certain areas as needed. Once it's done, then we can go through all the basic information for recovery. They can expect to have some increased pain, tenderness, swelling, minor bruising potentially. Generally, that lasts somewhere between 3 days to a week or so. They don't need to stop doing any of their normal activities as long as it's fairly light and not too strenuous.